Life in the UK and some of the challenges that we face in the NHS and social care, and especially some of the home care challenges that we have, and how we can start thinking about system leadership in a different way and how we need to approach it. Whoa, so how do I go forward on this? So the UK, as we can see here, population 64 million, just a bit of context setting. NHS budget, about 115 billion. 115 billion spent on the healthcare needs of individuals to 64 million people. Social care budget for older people is around 14 billion. As you can see from the slide behind me, by 2060, our population is going to rise to around 80 to 82 million people. That's a significant shift in demographic challenge. That's a significant shift in an older people's population that we're going to need to support and develop alternatives, exactly what's been spoken about before. Significant challenges. And West Hertfordshire, where I come from, and my colleague Tim Anfiligoff, who are here for the summit, we have a budget of around 700 million for Herts Valleys area. Across the whole of the county of Hertfordshire, there's another clinical commissioning group that has another 700 million. So 1.4 billion, plus we have a local authority that has to meet the care needs and social care needs of older people. We're split. As Austin said, this isn't an easy task because we're not just one NHS. It sounds fantastic, one health system. Actually, we have acute trusts, we have community trusts, we have mental health trusts, we have community nursing, we have a whole bunch of services that have been procured and commissioned out into the private, public sector, and we have to try and make all of that work and make sense for people, and that's a real challenge because actually navigation around through all of those systems is nearly impossible. You know, when we invented the NHS in 1945 plus, you know, this was for just one condition. You know, you'd live to about 60, maybe 65, you'd go in, you'd get fixed and you'd come out. Now you're going into hospital with 3 or 4 comorbidities. And actually, all of those things have a care need when you leave hospital. And to prevent people going into hospital in the first place, you need to be doing prevention and working on those areas. So massive challenges ahead. We have district councils. You know, so the multitude of political delivery and commissioning models is huge. So no wonder it's a challenge. And in my role, this is what I wake up to every day. And this is what all of the staff in the NHS, in social care, in home care wake up to in Britain at the moment. These are the kind of headlines that are flying around that are making it really hard for staff to keep their morale, keep boosted and feel valued in a world where they're the only people that are keeping the show on the road. And so at the moment, we need to make sure that we're getting the right message to our colleagues. I'm in charge of managing resilience within my system. I have a hospital, an acute trust, that is silted up. It has 600 beds. In Hertfordshire, social care has 6,000 beds. They just happen to be in people's homes. What they're not is in a hospital. What we need to start doing is caring for people in those homes appropriately, putting in the prevention, putting in the support that stops 7, 8, 10 ambulances stacking outside my hospital on a Friday night. And if you go into a hospital on a weekend in the UK, your morbidity rate is so much higher than if you went in on a Tuesday. So there's real challenges. And actually, we need to change these headlines. These headlines shouldn't exist. They should be, look how hard your community nurse is working. Look how hard your home care is working. Look at what we pay them and look at what we value them for. And actually start creating a culture change and a different conversation in the UK. Because actually it's about what our communities do for people, not necessarily what our newspapers do and what some of the public challenges ahead are. So how do we back some of this data up? Well, we have an ageing population. As you can see from this chart, the cost per patient rises as you rise in age. That's the interventions that we need to put in place for you, the interventions that we need to support people. But that's costly, and there's multiple interventions. On a Monday, you might go to see your ophthalmologist. You know, on a Tuesday, you might see a diabetes consultant. You know, and then on a Thursday, you might see your OT. I mean, we've made this system We design it. We're the people in charge. We need to get people together collectively to deliver the solution. And at the moment, those costs are going to rise. This is my graph of doom, and it's quite pessimistic. I used to walk around Hertfordshire showing this doom graph to the world when we were trying to integrate health and social care. And what it was saying was, there is a reality out there, and there's a conversation that we need to have that has to be fundamentally different. So if you look at the top line, this is Hertfordshire County Council's budget for adult social care. And as you can see, it decreases. And that's just going to happen. We're in austere times. Cuts need to be made. But if we do nothing, by 2022, every part of that council's budget will be spent on serving in adult social care and children's services. You won't have your potholes done, you won't have your street lighting, you won't have your bins collected, you won't have anything else done. And these are the things that are voted for by the public. But if we do nothing, we will be consuming all of those services at that rate. And if you're a patient, this is what you have to experience. Imagine trying to get around this. This is absolutely bonkers. And every part of that person is seen by a different part of that system. And again, we created that. We set this system up to deliver this. You couldn't have written it, 60 years ago that we would end up in this position. And then my final graph, it does get better, by the way. I haven't just come here to kind of depress you all. That wasn't 4,000 miles of trying to make you feel really bad. But if you look at how we spend our money, check this one out. So we're spending, and this is my blobograms, this is where we spend all of our money, and what we need to do is start moving those blobs to the left, because we're spending a huge amount of money on long-term conditions, on intervention. So why are we spending all this money intervening on long-term conditions? We should be preventing them. They shouldn't be happening in the first place. But all the cash is stuck downstream when people are really ill and they're really sick. And actually, we're intervening on end-of-life care. Look at the amount of money we're spending on end-of-life. That's intervention. That's not planning someone's care. That's not supporting someone going through a hospice and someone having a really dignified death at home. That's doing an intervention when someone is on that final pathway. That's people dying in hospital where they shouldn't be. They should be dying in their preferred place of choice. So what we need to do is start thinking and shifting all of those blobs to the left, all of that cash to the left, into prevention, personal health, self-management, people being able to live independently, look after themselves, take responsibility. We need to be moving in that direction. So what have we done? What next? So in the UK, we knew this challenge. We knew it was coming. We did nothing for a while. We talked, we pontificated, we did research, and we looked into a load of stuff, and we thought, what are we going to do here to challenge this and manage this? So we decided to go out and speak to people and try to get a saying. And I like this saying. It says, I can plan my care with the people who work together to understand me and my carer, allow me control and bring together the services to achieve the outcomes that are important to me. And we know that if we can deliver services within that sentiment, then we will be able to reduce the demand, keep people at home, keep them safe, keep them well, keep them living full and independent lives. So the government introduced something called the Better Care Fund. And Jeff, when he introduced me, said that we'd pulled locally £230 million of health and social care budgets. And that was our elderly care budget. We knew that we weren't doing what we needed to do in Hertfordshire. We already pulled 300 million of mental health and social care. So out of a total budget in Hertfordshire of 1.8 billion, about 600 million of that is now pulled. And that's done with the sentiment that we need to start ignoring who pays what budget. It doesn't matter whether it's a continuing healthcare NHS requirement, or it's a home care, or it's a residential care, or it's a nursing care. If we put the money together, we're all accountable for that money. We need to make those services then change and empower frontline professionals to go and deliver. At the moment, we hand-tie them, so we need to make that happen. There were some big conditions and challenges. 7-day working. Do we deliver home care 7 days a week as effectively as we do on Tuesday, Wednesday, and Thursday? We don't in a hospital care. We know we need to improve that. We need to agree plans. We need better data sharing. If we go back to that crazy chart where the patients flying around the place, the reason they're flying around the place is because they aren't being shared. They're going and repeating their story 10 times. They're meeting 20 professionals, and they're having lots of people come through their front door who they don't know and aren't consistent. And if you're 85, you don't need 10 people a day coming through, one to give you a meal, one to do some OT, one to do some wound dressing, one to do an IV drip. That's what we're doing to people. So what? You can put all your money in one pot, but that doesn't change anything because we still have the government, we still have the bureaucracy, and we still have a way in which we need to travel to get those money into the frontline services. So in my view, we need a collaboration. We need a different kind of language. We need a different kind of conversation. In social care, we call people service users. In the NHS, we call them patients. Well, we can't even agree what a person is, and all they are is a person. You know, actually, we need to start redefining the language that we use consistently. We need something intersectorial. We need to be working across sectors. We need public health. We need education. We need schools to be involved. We need a whole journey that manages an individual's life. And we need to then be working, as you go through your life cycle, to be sorting out some of the things that Jeff was talking about in Austin around planning for aging, you know, planning for getting old, and actually a real conversation about end of life. And if people are going into, you know, early stages of diagnosis of dementia, we need to make sure that we're having a proper conversation. GPs in the UK are still struggling with diagnosing people with dementia because it's bad news. Yeah, it is bad news, but if you don't tell someone early enough, they can't do their planning, they can't get their wills in place, they can't go on a holiday that they couldn't have gone on 5 years ago if you told them so late because you didn't want to bear the news. They can't get their life and organised and things in planned. So there's some real challenges. To me, it's about how we change culture. And what we've done locally is done the navigation. We've worked hard, and if you come to our afternoon workshop, Tim and I are going to be talking about things like hearts, help and carers. And we've created a single number that says, we're not going to do the job for you, but we'll find the man who can. And the idea is that we then fly around and we sort out the interlinks that aren't connected, and we stop doing referrals when we don't need to refer people. We have community navigators. So we know it's so complex, and actually if you are frail and you're old, we give you someone who's going to hold your hand and walk you through that complexity, walk you through the spider diagram of you know, services, because it is really hard to get yourself from point A to point Z. Home first, we know integrated teams are essential, so we spent the last 2 years pulling our community teams together, rapid response of 1 hour when an older person's in need, actually bespoke home care packages directly in these teams that are to support people when they're in crisis. We don't go through a social care referral, we don't wait till the crisis is so bad that you end up in the hospital and then we pull you out. We get you straight into that team, and that team is having home care workers working with community nurses, working with mental health nurses, working with GPs, and they work as one team, they don't work in separate organisations. Big culture change. Took us about a year of actual training to break down the barriers and the social and organisational boundaries that are being built up with these professionals. So big challenges ahead. Carer champions. Every GP surgery on our patch has a carer champion. Those people are responsible for finding, identifying and understanding who is a carer in that practice. Because how many GPs really do ask to a 90-year-old when they come through the door, or doctors, do they ask, so how did you get here, Mrs. Miggins? Because actually, if she was driven by someone or she had someone giving her a lift, then you might want to say, well, is it your husband who has to drive you around a lot? We need to keep your husband healthy. Keep him healthy. We're going to stop you from decompensating. And it's been a revelation, and it really has changed things. We've got health checks happening. We know that if we're keeping our carers and caregivers healthy, we know that at the end of the day, we'll maintain this system. Because when they're not, both of them end up in hospital. So what are my parting shots and thinking about the challenges that I'd like to leave you all with? There's something about system leadership, and Austin tapped into it. He was saying, your leadership can go from every levels. It can be all the way from a Prime Minister and President, all the way down to your frontline worker. Actually, it shouldn't be down to your frontline worker. It should start with your frontline worker and come down to the President and Prime Minister. That's the way in which we should be having this conversation. These are the people who meet the individuals every day in and out. How do we create leadership, and how do we teach leaders to be led? Because if leaders can be led, then we know that they will go forward with the free thinking and the innovative ideas that are coming from the bottom up. New common language. No more health and social care boundaries. We need to be talking with one single set of languages. If you came into a meeting with me back in the UK, you would need a translator. It is that complicated. You sit there, and then we bring service users in. It's even more mad because they don't understand what we're talking about, and we don't understand what we're talking about half the time. We have just created acronyms beyond belief. Champions, we need to champion visions. And we need community empowerment. This happens in communities, dementia-friendly communities, learning disability communities. We need to be making communities responsible, safe, and supportive to one another. Sharing stories. That's the most powerful thing in my life, has been sharing the stories. Promoting best practice, helping change that culture. But we also need to, and this is the big challenge, zero tolerance. We should not accept anyone gets poor quality services. We should be zero tolerant of when we see things, and it's not our duty to do it when we go into someone's house. Actually, if we see the carpet frayed when we go in because we're delivering a Meals on Wheels, let's put that carpet down so the person doesn't fall. Let's not think that, oh, that's up for the OT when they walk in and do an assessment and tick it off on a bit of paper. Let's move to a world where we can not accept, or that we do not accept, poor quality services. So, when I came, I'm quite proud of this slide because I have a 9-year-old son back in the UK, and he loves Pac-Man. He loves computer gaming. He just loves doing things like that. And I said to him, I'll see if I can get Pac-Man in your slides or something that would be really cool, and I'll send it back to you, and then you can tell me what you think about it. And then being an 80s guy as well, I kind of grew up on this stuff. And I emailed him, and I said, he's 9 with his mum. I said, well, so what do you think? I've managed to get it in the PowerPoint. And he said to me, but Daddy, why is culture eating strategy? So I thought, how do I say this to a 9-year-old? What do I respond to that? And I said, well, that's what it is. It's about culture. It's about who you are, not what you know. It's about who you are, not what you know. And actually, you can know everything. But if you can't get the culture right, nothing will change. Everyone will do the job they're paid to do. And actually, for me, it's about, and the challenge to everyone in this room and to all of my colleagues and myself, is how do we make that culture change? Thank you.
To you, David, I was really struck by your comment about along the lines of elevating the front line. And I'm a huge believer that the best ideas do not come from the corner office, but instead come from the front line, the people who are doing the work every day. How do we empower them to activate on those ideas and then systematize them, right? And when you think about in a highly regulated area where there's lots of government layers and the bureaucracy involved, but how do we get those best ideas to filter up and then out through the system? Thoughts on that?
I think that is one of the biggest leadership challenges, Jeff. I think some of we're indoctrinated into having managers who manage managers who have managed managers who manage managers. So the world loves a manager, and I think what we haven't been able to do is also, and once you become so high, you don't want to be toppled, do you? You want to be the person who can come and forward with that innovative idea. So to me, we need a different kind of leadership. The leadership we currently have isn't the leadership that's going to get us through the next 20 years. We need leaders who know how to be led. And if we can have leaders who know how to be led, then we can enable those people at the front line to start being experimental, to start trying things. As far as I'm concerned, if you do the wrong thing for the right reason in my team, I will always bail you out, and we will always do the right thing by that person. But we need to give that trust into systems, and leadership designed on a model that says, I am at my level because I know more than the person who is below me, is the wrong kind of leadership. So
Amen.
I think we need to develop that.
Yeah, excellent. So how, I think at the essence of this is culture change.
Yeah.
How do we get, we can sit here in this room, but how do we get the people out there? We're in Ottawa, we're in the capital. How do we get the government to understand that? How do we get policymakers to, they're not going to willingly just give up control. How do we educate them to that? How do we create that culture change?
I mean, that is the significant challenge, in the sense that it's about empowering a voice, in my mind, and how that voice can then be disseminated through the system. We are now starting to have conversations because the position that we're in the UK is starting to become untenable. There has to be a voice somewhere. And actually, the empowered junior doctors who are now coming through the process, nurses, community nurses, even home care workers. Their voices are now starting to get power and starting to get position coming through. I'm not sure. There will be a tipping point, and that tipping point is kind of we're in that position now where services are unsustainable, the voice needs to be clear. Everyone has got a mum and everyone's got a dad, and it's really amazing, isn't it, when you get into a world where a politician suddenly enters the experience of the things that we have just talked about, that can really move mountains. It's a pity that it has to be through that experience, that it has to move mountains, but actually we're all going to be living in this journey, and we need to make sure that that's part of the learning. And I just think we are all part of this system, and if we collectively start changing our conversations with one another, that collectively changes the conversations with everybody else as well. So it's the narrative to how we speak with one another, I think, that then suddenly starts moving. You can't change policy that quickly, you can't change governments that quickly, but you can change the conversations that governments have, and that's almost one of the things about why I wanted to be here was trying to propagate the message and start saying that it can be a different conversation.
I loved your graph of doom, by the way, because I think that's part of the answer. I mean, this is a mathematical certainty, right? I mean,
Yes,
it is going to happen, and it doesn't have to be that way. But it seems that government doesn't react unless and until there's a crisis.
Yep.
And we're approaching crisis, but let's not get there, right? We can alter this course. To me, it requires a movement of the people,
Yep.
right? So thoughts on, and I loved your slide where government is an enabler for all of this to happen. And then, so in closing, last question for each of you. What's the one big takeaway that you would like our audience to leave with? Something practical that each one of our members of the audience can do? Because I'm a firm believer that culture change starts with the people, starts with things small. Government reacts to that, so we have to lead that. So what is the one thing that you would recommend, one thing you'd like to leave the audience with?
From my perspective, it would be keep talking. Keep talking about the things that you see every day. Keep sharing. Keep your links. Keep your,